succession to the videos what I have been taking up in general medicine. So today's topic of the discussion is about how to treat a case of hypoglycemia. So in general medicine, it has been quite frequently asked to you that as to how you are going to treat a case of hypoglycemia, and there you are supposed to write in a short note as how to manage such a patient. So in this video we'll be discussing about how to treat a case of hypoglycemia. So the treatment of hypoglycemia, first, what you should summarize it in the form of points. The first is glucose. So firstly, if the patient is not unconscious, or in a conscious patient, if the patient is awake and he is perfectly in consciousness, so such patient should be glucose and sugar containing drinks or liquids should be given to such patients if they are in the conscious condition. And if the patient is unable to take glucose orally, so the patient should be given 50 cubic centimeters of 50 cc of 50% glucose IV is given to such patients. Now, the once this hypoglycemia is not being controlled, and if the patient is conscious, this resort can be taken. But when it comes to the next resort, that is in the drugs, what can be given? So the drug, when we look at the drug, that first is the epinephrine. So what this epinephrine, that 0.5 cc of 1:1000 epinephrine is given subcutaneously. And when we, the next important drug consideration is the glucocorticoids. So glucocorticoids forms the drug of choice for treating the hypoglycemia. So in glucocorticoids, 100 milligram of hydrocortisone hemisuccinate or 4 milligram of dexamethasone IV is given. So 4 milligram of dexamethasone IV is given to such a patient. The next is glucagon. So glucagon is that hormone what is responsible for conversion of glycogen to glucose. So glycogen to glucose, that is the stored form of glucose is glycogen. So if the stored glycogen needs to be broken down, so that is this hormone, that is glucagon, what is responsible for the conversion of the stored glycogen into the glucose, so that the blood requirement of glucose is met. So glucagon hormone can also be given to such a patient if the patient is unconscious. That is 1 to 2 milligram intramuscular glucagon injections should be given to raise the blood sugar level. And the last drug, that is the mannitol or the furosemide. So these are the actually the drugs what are used in the diuresis. So for diuretic treatment, the mannitol or the furosemide is given to reduce the symptoms of cerebral edema. And so the next treatment method, the next treatment of hypoglycemia, it should be the conservative treatment or prevention. So in order to prevent such a situation of hypoglycemia, the patient should be given the carbohydrate diet is given not more than 1500 grams in the form of cereals, in the form of white bread or something. So this carbohydrate diet is given. Apart from this, liberal protein is given to the patient so that these proteins can also be converted to carbohydrates or glucose through the process of gluconeogenesis, which is the conversion of glucose from non-carbohydrate precursors. So liberal protein intake is given for the conservative treatment and management. And last, in a patient of hypoglycemia, if the patient is having this hypoglycemia condition, it is manifesting in a particular patient, the doctors, in order to prevent this condition of hypoglycemia, the doctors, they suggest that for prevention, restriction of physical exercise is done to such patients. So students and viewers, this was a very short discussion about where I have tried to give you in a very brief gist as to how you are going to treat a case of hypoglycemia when it comes to short note, or it comes to a very short note in the form if you are supposed to write in the professional exams. Students and viewers, if you still have any queries or comments, you are most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.